you, Pierce.
Perfect. A lot, Kelsey. So I'm Pierce, as Kelsey mentioned, from TELUS Health, and I'll be showing you the child and youth mental health modules that have been integrated into the MedAccess EMR. A lot of you may have been with our session last week looking at adult mental health. So a lot of the things that we've gone over in terms of workflows are going to be very similar. What I'm hoping to do, actually, before I get going, I'll just double check everyone can see the screen so far. And just to double check, you should be seeing this little handout sheet. What everyone's seeing?
Yeah, it's Kelsey. I can see that.
Okay, perfect. So what I've done is I've just placed this document up there if everyone would like that for a resource. It's a little out of date because this is something that we shared at the PSP demo day in Vancouver. The only thing here is it's saying coming soon to your EMR. They're now, all content is in the EMR now. So, but this is a good overview of what all the resources that are sitting in the MedAccess templates. So I just wanted to post that for you. But I'll switch it over so you can see my screen.
It's PowerPoint, Pierce.
Okay, great. Yep. Okay. So as we go through today, of course, be sure to ask me questions. Either you can raise a hand electronically and type in a question, or just go ahead and unmute yourself and ask me. So I'll give you a brief overview of what the integration process is, or what's actually built into these templates. And then I'd just like to share how to access those templates, because you might be working with physicians and users that don't know that they're there. So I do want to show you how we can get to those and make those favorites. And then to go over the templates with you. So we have scenarios just to show you how this would work and to all the different features. So the integration of all the mental health content, that's including adult mental health as well. There's over 50 tools and resources, and those are all made up of either URL links, so resources, websites, embedded handouts, so these could be assessments, questionnaires, and patient resources. And then the third piece here would be built-in questionnaires and assessment tools, and these are tools the EMR will calculate scores for you. So traditionally with your paper copies, you'd have to tabulate them. The EMR will be kind of calculating that for you, so you just need to answer the questions, and you'll get your score at the end. And key features, of course, the benefits there is, of course, that's saving some time for users. And the big thing is it provides a discrete field, so a place in the EMR to put that if we want to track patient care over time. If we'd like to go back and look, at our patient populations and see how we're doing as a group, there's discrete data fields to do that with. It's just placing all those resources in one central space that they're already working, of course, in their EMR. Last week when we talked about the adult mental health content, there was 4 different templates. When it's the child and youth mental health material, we've put it into 2 templates. So first, a screening, so child and youth mental health screening visit for template, and the second is the kind of comprehensive child and youth visit. Workflow here is intended that when a clinician's meeting with a patient, they would start out with the screening and then continue care with the ongoing mental health visit template. Close down my PowerPoint here, and we'll hop into MedAccess. Get going, I'm going to move a certain support consumer mode. Anytime that a user or clinic calls MedAccess, the support team can't see patient name, so this is just me turning that off so we can take a look at our example in there. I'll start out by opening a patient chart, and we'll take a look at how to access these templates. So patient search here in the top right-hand corner. And I'll just so we can see here. So I'm starting on our Visit Encounter tab. So this is where physicians will be putting in their SOAP notes and all of their information from their encounters. And to find these templates, top right-hand corner, this one will go to create a new visit. Open this up here. When you visit, we've got a template button in the top right-hand corner. So when I click on this here, you're going to see a few templates already here. These are really just the templates in my system that I favorited for myself. So these are templates that I'm using on a regular basis, and they show up for ease of use, or ease of access, rather. See here that our child and youth mental health templates aren't here. So to find those, we need to click on the Find Observation Template option here. So click on those little binoculars, and that pulls a search box for us. And I'll do a little bit bigger so we can, so we see it. Listed, and that's available in the system. And the quick way to go there is just to do a keyword search. So I'm typing child, and it narrows it down. You could also mental health, but these top two ones are the templates. So first is our screening, and is our mental health visit. Someone that would like to use this regularly, I often suggest making it a favorite. And to do that, all we need to do is click these heart icons. The one left-hand side under the user column are for that specific user. If this is a template that everybody in the clinic is going to need to access regularly, if we click the clinical favorite, everyone will have access, or everyone will have it listed in their favorite list. But for my example, I'll go ahead and click on the user favorites. Okay, once they're engaged. And demonstration, I'm going to back out here. Coming into a new patient chart, we want to access these templates. We could very easily just right-click New, and we can see now the child and youth mental health screening is available. Any questions so far? Okay, so once they're favorited, we can also just quickly access it from here. So we don't have to click New and add a new template. So I'm going to start off by showing you the child and youth mental health screening piece here. To get into some of the scenarios, I'll just mention some key pieces that I'd like you all to be aware of. So we're looking at the actual template. A couple of icons. So the first one is this little little question mark icon. So we see these. Clicking on them will give you either some guidance on how to use the template. Some of them will include clinical guidance that were in the resources. Hovering over these is going to give you some more information. And the first one for historical questions, it says click to expand or answer our historical question. So if I was to click this Show Radio button, it opens a section for us. Good piece to remember. The next one that you're going to be seeing is called CDS Launch buttons. So there may be some resources that clinicians will fill out in a different task or elsewhere on the chart. That's a little icon right here. So it looks like a little notepad with a check mark on it, and when you hover over it, it's going to say Create Task. And you see something like this, we can click on that to open a new task. This was one of our questionnaires. there's a couple new icons too that I'd like to let you know about. Then a little calculator icon. So when we're to some of these calculation pieces, for example, with our CAD score, you could go through and, of course, answer these questions. And the little calculator will calculate that for us and place it in the system. Okay, our CAD score is at 8. Into that, anytime that you'd like to see some historical data, have we entered this on the chart before? Let's see what it looks like. You can hover over any observation. So the name of the observation can be hovered over, and if there's anything already logged in the system or on that patient's chart, it's going to populate there for you. So you get, we've had a couple previous instances where we've gone through and done the CAD score with this particular patient. In addition to that, if a doctor would like to look back and show a patient, over time, maybe they've been doing some treatment, maybe they had a plan that they've been following, you can also click on these observation names as well. So in addition to hovering over and seeing that history, we can click on it to view a graph. Okay, and that'll populate that for you. So then we could say, well, let's zoom in here, we plan at this stage, and you can see how certain things are changing. So that goes for any numerical value in MedAccess. So anywhere to not text, we can track that in a graph. Next little task that I launched, calculated the score. You will see that there's also an option on the main visit template to enter our CAD score. And we've done this so that if there's anyone that prefers not to use the electronic version, they can use a paper copy and enter the actual score right here. So if I down one more, you can see that I could click this button or our scared score or our scared assessment and enter it there, or we can click these links for the PDF version and just manually type out the score. So it gives the option, depending on which doctor, which clinic is using them, how they prefer to do it. The icon, I'll just point out, not relevant as the others, just as an afterthought, are these little printer icons for internal use only. This just makes sure that if anyone's going to print this out, if it's a visit that needs to be shared, anything that has this little printer icon with an X doesn't come out on the printout. So, and you can see some of these resources to launch the paper copy. That's not going to take up space and come out on the printout. So far, or the functionality?
It's Kate here. If you just put in the number instead of actually doing the electronic score, you still get the graph the same way.
Yeah, absolutely. So you can see that first one that I had showed for the CAD score, hovering over here, it'll show the previous values, and we could also enter it as well.
Okay, thanks.
Yeah, you're welcome. Thanks for the question. So what then is I will move on to some of the scenarios that we shared at the PSB demo day as well. And the first one was to look at depression. So I'll stay on the same chart. You can see this is my depression example. There was a 15-year-old male comes into the office with their mother, and the mother's concerned that the son is withdrawing to their room, losing weight, and playing lots of video games. So that was a scenario. I'll just show you how this would work then. Start, we'll do the same steps. We got that template set as a favorite, so we're going to start, of course, with this screening. I know that this chart has some information on there, but let's just assume this is a first visit encounter. Here is answering some of the historical questions. And as I already showed, is in a show and hide feature. So if I click on that show, questions. So parent of mental disorder, I'm going to click no here. I'm just going to go through some of these questions. Okay, and once they're of course in the system, and next time we have a visit, we can hover over to see the last results, in case you don't want to ask these questions every time. And then the screening, what it's designed to do is based on these current situation questions, it'll direct you to different areas of the template. So for my first example, what I'll do is answer yes to this first one. So over a few weeks, have you been having difficulties feeling with things such as feeling sad, blah, or down most of the time? I'm going to say yes here and no to everything else. And what's going to say, if you answered yes to question A, suggests to move on to these pieces. See below that, if you answer yes to question B, and so on. So we had score, but I'm going to do it for our example here. And launch our Kutcher Adolescent Depression Scale. That's a new task, as we've seen. And I'm going to click these quickly to show you the workflow. Hit the cap to pop our score, and then go ahead and complete and save this. Now, one is here. It doesn't show you right here, so this is one piece to keep in mind. This is only for if I had chosen to do the PDF version and manually enter it. But you can see once I clicked save on that new task, it is sitting here associated with our visit. So you can see that we've done it. And then, of course, we can come back to it to take a closer look. These other questions here for B and C, we did answer no, so I'm going to leave these as they are, and you can see that the rest of the section, physician can enter the rest of their SOAP notes. I will save this, and I start a new visit, so whether that physician decides to move on to the next one or book a follow-up appointment and use the template again, we can, it works either way. I'll go ahead and mental health visit template. So the second template, which we haven't yet seen, the workflow is exactly the same. There's just some additional reasons here and a different workflow. So what we want to take a look at is our general assessment section. Again, those historical questions are available for us, but we do know we answered them. So if I hover these, of course, if I want to look back, I can see what we had answered, and I will get them out of the way by clicking hide. Assessments for depression, we'd want to take a look at our child or teen functional assessment. Okay. And for this one, I will first show you the handout version. So clicking on these hyperlinks. That I would have liked to see. So I'll have to take a look at that. Looks like the PDF version URL is not linked, so I'll make a note here to take a look at that.
Thanks, Pierce. I'll look into that as well.
Sure. One here so we can take a closer look. So here's what we should be seeing for the resources. But of course, we could do the paper copy. Score. Do the electronic version, of course. Create. And this one here is not one that creates a score for you, but just logging those questions. Have things been, where are you, etc. Now, next one, I know this is my depression example, but we had just done the CAD-6. So as you can see, that same resource is actually both templates. One I'd like to show you then would be our suicide risk. Okay, TSR-AM. Also a piece that will calculate for you. So if I click Create Task here, there's a number of answer. I'm going to use that at random just so you can see how this will work. This is our CAD score. This one was not a calculating one, so sorry for the misguidance there. So skip this one here. The next piece here we might want to take a look at is our anxiety depression medication scale. So if we were going to be moving on to medication or prescriptions, we click this here and this as well. So some of this may not be for depression. I'll come back to these in our other scenario. This, the CGI measurement, this is something that's going to be useful to measure progress over time. And so if you'd like some more information, of course, you can hover over there and it gives some information on what the global improvement scale is. But this helps monitor treatment for mental disorders. And every time we actually have a visit encounter with that patient, what we can do is mark how the treatment has been going. So are we much improved, very improved? Okay, and what that will do, if I click the calculator button, it puts the score in there for you. So as you can see in the little brackets, in the score. And if you'd like to see how they're doing over time, this is a great resource to actually graph. So in my here, I only have 2 data points. You can actually, if you're seeing a patient on a regular basis or over time, this can be a handy tool. Just to track overall, how have we been doing with our plan. Okay, next one, under self-management, let's take a look. There's a number of resources here, but what I take a look at is our here. So first, this one, it would be for anxiety or worry-reducing prescription. I'll take a look at our mood-enhancing prescription, so the MEP resource. And there, as it is an embedded paper copy, but we can go through and actually enter and how often and with whom that we'd like to do them. So this would be the prescription that our physician would go over with the patient. We can fill that out and they print it if they'd like to send the patient away with it. The next self-management piece for this area would be our support plan. So if I click on that piece here, is another to fill out and send it away. Most of these in section will be resources for the physician to go through. The next one, these would just be letters, so assisting with creating some of these letters. The first is for school support and accommodation. So if we'd like to send a letter out to the school that can easily be accessed here. In MedAccess, we've got a lot of macros in play, so when we actually get this double or actually body of text, it pulls in the patient's name and what we're looking over. So there's one for school accommodations and one for psychoeducational testing. And for professional and one for family, so I'll show you the family one first. In MedAccess, again, these are pulling in patient name, birth date, age, all the information that's on their chart. Physicians, of course, fill out the diagnosis here, the rest as well, so for their actual support plan. What are goals, summary of condition, etc. If patient is relevant here, it'll actually pull out what's on the chart, but in my case, or this test environment, I don't have any active medication, so we'll just say no meds.
Here.
Yeah.
It's Joe. How are you?
Sure. Good. Yourself?
I'm just wondering if you had populated the patient profile with the current or previous problems and the tools that you use, would it also populate it into that document? Or that's just is that mostly a manual document?
These ones here are a little more manual, so
okay.
These won't pull it in. It would be fantastic if they could, but we don't have that ability. Also, I may not be the best resource on this piece here, but I believe this might be a little bit more complex than what MedAccess users would be used to putting in as a, an ICD-9 diagnosis.
Right.
Yeah, but this is a good question because I do want to show you how to document those conditions in the chart as well.
Okay.
So that at the end of this template here. Last one for all the scenarios that we could use is the Confident Parents Thriving Kids BC. And historically, MedAccess users in the system, they'd have to go fit it in their system, but it's just handy because it places it right there at their fingertips. Or they can fill that out and send it away. And when we get a template, there's two sections. There's psychotherapeutic supports used and also team-based care resources and tools. So what it is, it's just a checklist to allow users to mark what they've done or what resources that they've used in care. Road, if they'd like to do reporting on how their patients are doing, we can actually see, based on what supports have been used, how care is going. So it's a step, but I encourage doctors to use it so that they can, of course, click, yes, I used the mood-enhancing prescription and under team-based care, I'll click show. We've put in show hide just so they save a bit of space. We use the Confident Parents Thriving Kids BC referral, and so on. Next big document, but under references, of course, it's our Child and Youth Mental Health Algorithm, the PSP resource. New piece, it's got a lot of content in there. As you can see, it's taking a little bit of time to load because it's a fairly big document. But of course, it's easy to access from here. And for other resources, we've got so this little arrow at the very bottom of the screen, that'll other web links and resources that we could access. I'll just click one. Resources are available at the bottom too. Now to Joe's question, which I realize isn't exactly the answer to your question, but talking about diagnosing a chart, you could see we started off with a screening template, and in my scenario, we hadn't diagnosed the patient with depression, but if we wanted to do that, we do that right from here. So right from here, if I'm going to document this chart with depression, I'll type in 311. What I'm going to show you first is pulled into the system. You see there's a little icon here that is to the right. Now, what this is telling us is that it's not on the chart already. Anytime that button shows up, we know we actually haven't documented over here in our patient profile. So if I go add diagnosis to profile, it creates. So for those of you less familiar with MedAccess, all medical conditions are stored in this little profile tab. They're in your sidebar here. Now, it'll show us once the page refreshes because we just added it. But you can list it there. If I click on any one of these, it'll show you what it's done. It's placed this on the chart as a medical condition of depression with their ICD-9 code of 311. So anytime we see this patient, I'm going to see that icon anymore. It's going to be in our list of options because it's already on the chart. And I'll give you a little quick example of that. I'm going to here. If I was this patient again, and I still left a visit in, started another mental health visit. As I click in there, you can see that 311 is at the top of the list because that's stored on their profile. So about depression, just very easily, you can just select that and move on. Any questions on that so far? Now here, and I do realize we're coming up at 20 minutes, so I did have 3 scenarios. I will show you just one more for the sake of time, but as you see, the workflow is still the same, just on the condition and how a physician will want to go through and use the resources. So the second one I'd like to show you is for anxiety, and I'll put that chart here. This scenario, we have an 8-year-old female who's worried about going to school and is complaining about having upset stomach almost every day. So I'm going to start again with our screening template. So right click, and now it's a favorite again, so we can go ahead and screening template. And workflow starting our first time here, we're going to take a look at the historical questions. Take all of these. And when I move situations, I'm going to be, so over the past few weeks, this patient has been feeling anxious, worried, and upset. For the rest, I'll select no. The next step would be interpretation. So under B on to answering the scared scores. So to this piece, under B, there's a resource for based on age, so child and teen. What I'll do is I will click first on the paper version. If we want to answer these questions, we could. Manually enter them. Now, what's about some of these resources here? I believe the PDFs will calculate as well, and you still have to manually enter it on the patient's chart. So we can answer those and after the score, or alternatively, we could click the task and do it from here. These because it's fairly long. it should generate this score. If I were to go through and answer all of these, it will start giving you scores for all these different situations. So anxiety, separation anxiety, it will, based on questions that we answered, it will score those sections for us. At any time, if you click a calculate button, it calculates for all of them. So there's no need to go through and click all of these in a row. Clicking any one of them will calculation on all of the observations. And the one that's electronic, just because as you can see at the very bottom, it's a little bit more of a complex one to score and would probably take a little bit of time to do it on paper. This one was for child and teen, and then the second one is actually for parents. So the parent can actually answer those same questions from their perspective. Okay, and they're almost exactly the same. It's just written for the parental view, and that would be handy for the physician to see, how does that contrast. So let's visit here. And our mental visit template. And just a little bit, I'll skip the sections here because we've gone over some of them. We want to diagnose them with anxiety already, so we could start by putting that in. Of course, that same step, adding it to the profile, so we're documenting that. Under, do you want to take a look at our teen functional assessments? Okay, went over those with the depression as well, but one that can certainly be used here as well. And let's see if there's ones that we haven't taken a look at yet. So we went over most of this, our measurement. The one that for anxiety would be our worry reducing, very similar to the mood enhancing one, but centered on worry. So we fill this out with the patient and print it off. Again, resources could be used as well. Piece I haven't showed you yet would be for attention deficit disorder. So this would be the side effect scale for ADHD, and so the sex scale right here. And that's one piece that we hadn't gone over. But see, this would be here if we were looking at ADHD. Again, could enter all those supports that we've used if we want to track this over time. As with all the templates, again, all of our resources are available at the bottom. So maybe flow is fairly clear. I'll leave that there. I did want to leave some time at the end of this session, about 10 minutes or so, for questions. Did anyone have any questions about the material? Or anything I've gone over that wasn't quite clear? I'd be happy to circle back.
It's Tamara in the Northwest.
Sure.
Clinics that we're working with child youth mental health template visit template, but it looks different than those. Have these replaced that?
So yeah, that's a great question. So what I'm guessing, this is the first mental health templates that we've put in and distributed to clients. So what I'm assuming is that maybe the clinic that you're referring to has made their own, because in MedAccess they do have the ability to create their own templates
Okay.
They may have just, had the need for it and went ahead and created something that worked for them.
Okay.
So what I suspect is that what's here would definitely, complement what they're already doing, and maybe it could fully, with the amount of resources, I'm assuming it could replace. But of course, I haven't seen their template.
Right.
Yeah.
We got a lot of the similar information. Yours is definitely more robust. So
right.
Yeah, I'll show that to the clinic and have them choose one they want.
Yeah, absolutely. No, that's a great question.
Thank you.
Thanks.
Tamara and Pierce, it's Kelsey. I just wanted to add to that. I mean, just another piece of, just something to think about around that is, I think the benefit of PP having worked with the vendors to create sort of provincial standards around these templates will give the ability in the future to actually start comparing, how pain is managed on a provincial scale, and that could start very small in clinics, kind of with peers, kind of maybe sharing data with each other at little data meetings that could start to grow from there to go to, a division or maybe a pain cohort. So I think that there's lots of opportunity there, and that's one of the benefits in using standardized templates, so that when we're talking about comparing data at some point, across even vendors, these kinds of standards will be important.
Yeah, that's the point. And so I will add an afterthought to your question too, Tamara. In MedAccess, of course, my feelings on this template is really robust. It's a great resource. It's one that I think, everyone should be using. But stopping a user from pulling in sections into their other templates. So if they're finding that some of these resources are really handy, and some of the templates that they have already, they can absolutely pull sections into their other ones. And then, of course, use this as their kind of comprehensive one go-to when needed. They're using, the resources as well that have come down from PSP. Mm-hmm.
Hi, Pierce. Ranjit from Fraser. Hi. Would every MedAccess user have access to these updated tools and resources? And if so, as of when?
Yes.
So versions that you have to be of MedAccess in order to upload these tools?
Okay, so great question. These tools and resources are on every MedAccess client site already. So everybody, regardless of version, has this out today. So if you're a MedAccess clinic, you've got these. And were pushed out, I believe adult mental health came out in March, and I believe this went out, I think, a week or two after that. So they've been in there for a little bit of time.
That's great. Thank you.
Yeah, you're welcome.
You've been receiving a lot of questions from clinics since you've put these out. Or have you sort of a lot of feedback already about how they work or questions around it, or not so much?
I'm happy to answer what I've seen. I'm not in our support team, so I don't get the front line. Kelsey, too, I don't know if you'd like to weigh in on that as well, because we shared this at the PSP demo day, and you were also a part of our as well. So effective, yes. I've definitely seen physicians excited to see these resources here, because when you need them, I think the difficulty has been, the time that it takes to pull them in and start using them, and also, knowing that certain resources are there. So I've seen there's a win scenario there. A lot of these pieces take time as well. So also setting expectations to know, how much time you might want to spend with a patient to go some of these. And of course, these calculation pieces have also been a huge win. So you don't have to go through and calculate. That can take time.
Right.
Yeah. Kelsey, anything else that you wanted to add there?
Yeah, so certainly to fully acknowledge that, yeah, we at PSP Central haven't, really haven't done anything comprehensive around, what I would call like an implementation plan of these tools. So, been busy working away with the various EMR vendors to create the tools. Now, of course, but we really haven't taken sort of an active approach yet in promoting them, and that will be definitely changing this year. So I am working closely with Aaliyah and the rest of our team here at the central office to engage with your leads to figure out what does implementation look like? What training do you folks need? What is your role? Like, what is the scope of the RST role in the support? What is the role of the vendor in supporting this training? What is the role of the peer mentors and GP champions in supporting this? So we are very busy, getting some of those details together and plan to make that a focus this year. So certainly stay tuned, and we want to make sure that you guys are prepared as a team to support this more broadly. So the idea is that the tools are there and available for physicians and clinics that want to utilize them, but we acknowledge that for the greater majority of practices, they're probably not going to see mass uptake or maybe sustainable uptake until we have some more supports in place.
Right. Okay. Thank you. Yeah, that's kind of where I was going with that. But, it's fabulous to now have such a robust tool to work with. We've been asking for that for years. So amazing step forward.
Good. So there's no other questions that have come through on the chat either. No questions or thoughts from the group before we wrap up?
Hi, how you doing?
Okay, we'll take that as a no, not right now. You're always welcome to contact me if you have questions about this after the fact. Also, just wanted to remind you that the recording will be available probably within the next week or so on your RST Divot site. So we'll send you an email letting you know when that's available. Thank you, Pierce, so much for your time. That was a great presentation. And yeah, everyone can go and regain 5 to 10 minutes from.
Thank you so much.
All right. Thank everyone.
Bye.
Okay. Bye.
Bye.
Cheers. Bye.
Thank you.